Hi, good afternoon. My name is Raven Huey, and today I'll be going over the anatomy of the brain. When I hold the brain this way, this is called superior view. So up towards the front of the brain, we call this the frontal brain. When we go a little more back, we have the parietal lobe. Down towards the side is the temporal lobe, and then towards the back we have the occipital lobe, and then the hump is called the cerebellum, and then this cord right here is called the spinal cord. When I turn the brain this way, this is called lateral view. So down here towards the back we have the temporal lobe. Then we have the pons, we have the medulla oblongata, then we have the hump again, which is the cerebellum, and then we have the spinal cord. When I flip it like this is called inferior view. So up here we have the olfactory bulb, we have the optic nerve, the optic chiasma. This up here is the frontal lobe, and then when we go down here towards the side, again we have the temporal lobe, we have the pons, we have the medulla oblongata, we have the hump again, which is cerebellum, and then we have the spinal cord. Now, when I cut it in half, this is called the sagittal view, and with the sagittal view it just divides the brain into left and right sides. So over here we have the corpus callosum, we have the cerebellum right here, we have the pons, and then up towards the front we have the thalamus, and then over here is the hypothalamus. So the brain disease that I decided to talk about, or the disease that affects the nervous system, is dementia. So when we have dementia affects the memory, and this deals with the hippocampus. And so the psychological changes that happens with this, that it can affect a person's appetite, it can affect depression, it can affect their memory, they can get very agitated, things along that nature.